Welcome to Startup Health TV. I'm Logan Plaster. Diabetes is one of the great health challenges of our time. According to the WHO, it's one of the few big chronic disease killers that's actually getting worse with time. When you take into account the whole community with pre-diabetes, we're talking about hundreds of millions of people at risk of premature death from this disease. The kicker, and what makes this such an interesting opportunity for impact for health innovators, is that diabetes can be managed or mitigated through things like a healthy diet, active lifestyle, or medications. So my guest on today's show is Mark Clermont, the CEO of Cecelia Health. We talk about Cecelia Health's unique approach to this problem. It all comes down to the human touch. You see, Cecelia Health recognizes that there is a proportion of the population with diabetes that won't proactively seek to manage the disease. So they hire trained diabetes coaches to walk with patients as they get healthy. We'll talk about all this in the interview, as well as how Cecelia Health is looking at new chronic disease use cases for their platform. Stick around.
Crazy dog.
Mark Clermont, CEO of Cecelia Health. Thank you so much for taking time with me on Startup Health TV.
Yeah, glad to be here, Logan.
So, we've been at Startup Health, we're big fans of Cecelia Health. We've been watching your work for a long time. We know you're in the diabetes space, kind of where it intersects telemedicine, virtual care, nutritional guidance, but remind our viewers who might be less familiar specifically what Cecelia Health is.
Well, you hit the nail on the head in terms of diabetes management, but the company's actually expanded beyond that. So one, I'd say diabetes management, all the way through virtual care clinic. And it's one of the things that we'll talk about in a second. Very excited about that. But we've also expanded into other comorbidities, be it cardiovascular, COPD, mental health, frankly, all facets that kind of that come along with common comorbidities with diabetes management. Largely, we're looked at the diabetes management player in the space. There are a lot of them. But if you look at someone with clinical competency that provides human interventions that are supported with technical interventions, those are few and far between. And that's really where Cecelia shines.
Break that down for me. So let's just say I've got one of my best friends has diabetes. My friend's daughter has diabetes. Let's just take a case study and walk me through what's unique about that Cecelia Health offering. Obviously, there's other verticals you just mentioned, but we'll stick with diabetes just to start.
Yeah, absolutely. So let's also make the observation that we, over the course of, every year, there are new technologies that come out, and that may be new compounds, that may be new devices. It may be compounds paired with devices. And so, certainly diabetes in and of itself is a very complex disease. Type 1 and type 2 are both complex in terms of getting a patient to the point of self-management. And even if you are in a state of stable self-management, you can still get thrown off and you still may have a question. Mm-hmm. And the interesting thing is, with the advent of technology and new compounds, you're being bombarded with messages of change. And is this change warranted for me? Interestingly, we spoke with one patient just last week, had gone on to one of these device compound, it was a pen that injects insulin, and this gentleman had been using it for 6 months and yet was not feeling well. And so he came into us within our virtual care clinic, and over the course of the conversation, these are the things you can get through a video conversation. And you see that, well, demonstrate for me how you are actually preparing for this injection. And sure enough, there's a secondary cap on the inside of that pen. Mm. And he didn't even know that he was supposed to take the cap off the pen. And just something as simple as that, this individual thought he was injecting himself with the appropriate dose of insulin, and yet actually wasn't injecting any insulin for 6 months.
And you were able to bridge that gap because you're bringing this personal touch of a nutritionist, or what type of individual?
Yeah, well, in this case, that interaction was, and really, this is you talk about. You asked about the magic of Cecelia Health. You're talking to an expert clinician. So this is
Got it.
someone. Typically, it's a CDCES, someone who is, in the case of diabetes, someone who is well educated, well credentialed in diabetes, has the background to have that level of conversation with someone. But even more powerful is the ability to an experiential base to recognize, you know what, this patient needs to be escalated, say, to an endocrinologist.
Yes.
Let's get this person coordinated in with, whether it's with our own virtual specialty clinic, so national access to endocrinologists all across the country, or if they need to, the patient would prefer to be connected into his or her own endocrinologist or PCP, we can do that. The point is having the clinical acuity to recognize when someone needs to be escalated.
Yeah.
And then having the mechanism from a navigational standpoint to make that happen.
You know, it seems like so necessary for someone with diabetes to have someone they can turn to, this sort of certified diabetes, manager. You might not have this number, but can you tell me what kind of gap there is in terms of folks going around with type 1 or type 2 who have who don't have that, who don't have someone to turn to, who are sort of relying on the internet or sort of their best guess? What kind of divide are we looking at?
Well, look, I mean, you take a very real problem is ordinarily, you wish that there were more endocrinologists in the country. Reality is there's about 7,500 endocrinologists. At the same time, you have round numbers, 34 million people with diabetes. And so what you have is a high prevalence of treatment from the primary care site. And reality is what that introduces, one, it's a necessity, and not to take away from the PCP realm, but they may not necessarily be as focused as an endocrinologist would be. Reality is, in fact, it was just that came out a couple of days ago by the Health Institute. And what that showed, it analyzed variability in care, diabetes care specifically across different PCPs. And they found a lot of interesting things. And probably no surprise, the lowest performing PCPs were the ones that provided no education, diabetes education, and were not proactive in the in-between. So as soon as that patient leaves the office, if you're not following up with that patient in some way, shape, or form, more likely than not, they're going to recur and come back with some kind of negative outcome. So really interesting study and very powerful. So a powerful lesson for PCPs. But here we are in the state that we're in that with such a demand for care, specifically around diabetes management, and yet these amazing, powerful tools like Cecilia that have now emerged through virtual care, you can now have access to them. So we talk about democratization and access to patient care. One of the silver linings to come out of the whole pandemic scenario is this increased utilization of tools like Cecilia.
Sure. How would you characterize that growth? I mean, it's kind of generally we understand that there was a big uptick, but what did that mean in your industry specifically?
So one, the pandemic hasn't been kind to a lot of us, not just from the viral standpoint, but for people living with chronic disease. You'd think with all this extra, in theory, we have extra time because we're not commuting and that kind of thing. And reality is the early read on the data from 2020 is that with the exception of asthma, every other chronic disease state has accelerated. So here we are. We already have a scenario with 34 million plus people that have a need to help them understand diabetes and learn how to manage it. During the pandemic, you can't go into the office. And so one of the impacts we saw, certainly a significant increase in the volume of people accessing virtual care. And if you look at the numbers that the curve that happened March all the way through, you saw this tremendous increase in access. And I'm blanking on the numbers, our specific numbers at the moment, but we went from, so let's assume we had almost 500,000 patient encounters, diabetes patient encounters last year. That number was probably about 30% lower the year before that, specifically in the diabetes realm.
Just to shift gears a little bit more, I want to talk about you for a minute. You're new to this role at Cecelia Health. When did you become the CEO?
Just 2 months ago.
Just 2 months ago. So what drew you to this challenge? You have, I think, 25, 30 years experience in the healthcare industry. What was it about the Cecelia Health mission that drew you?
Well, I'll take a step back and acknowledge my father, actually. He was a now long retired surgeon, but he was a surgeon who got into medicine for all the right reasons. And along the way, had a tremendous influence on me in terms of the things that he would do to work with people in need. And just had a tremendous impact on people. And so as I was growing up, observing the impact that my own father was having, it made an impact on me. I didn't choose medicine per se. I found my calling in business. And as I started to apply that calling, I started to realize, okay, building business is what I'm pretty good at. So let me see if I can direct this in the right avenue. So from a mission perspective, I'm at least trying to live up to the great things that my father was doing for people. Can I buy into the mission and help accelerate that? And so if you look at my history, there's a long history of in healthcare in that same context. So fast forward, Cecilia, I look at a tremendous business that was started by David Weingard. All the credit to him to get it off the ground. And like many companies, when they get to a certain stage, you need to start bringing in people that have experience in knowing how to navigate the next level of scaling. So here I am.
You mentioned kind of moving beyond diabetes and into other verticals, into other areas of impact. What are you excited about building and growing as you kind of settle into this role?
Well, I think we hit it just a moment ago, really. What I'm excited about is helping people navigate chronic disease. Do we need to go 17 chronic disease states wide? Maybe that's somewhere in the future. Reality is there's so much need right here in the immediate, the really prevalent disease states of diabetes, chronic cardiovascular disease, COPD. Those are really the big three. So other things like renal disease start to cascade off of those things. Mental health. If you really tackle those things, you're really tackling the biggest problems that most people face. So that has me excited. And look, at the end of the day, it's somebody asked me, "Why? This is a really competitive space.
Yeah.
You sure you want to go into it?" I said, "Well, if you look at the swath of tools that are out there, they're mainly digitally focused, and by their own reported numbers, really you're addressing those individuals who react or engage well with digital tools. Call that 23% of the population. If you look across a swath of population who needs help, that leaves you somewhere in the 70-80% realm of individuals who don't necessarily want to be engaged digitally only or digital first. They really need the human touch. And we've somehow the promise of digital health 1.0 was this big panacea. We can scale and help people. And what we realized is that we can scale 23% of the population, but we still have this other realm. And so 2.0, fast forward, it's all about human intervention with digital intervention, and you become omnipresent and omnicapable in that context.
If one of our viewers right now has diabetes and they're thinking, I could really use that human touch, remind them kind of how you work through people, B2B or B2B2C. How do you access patients?
So most patients access us through their health payer. So their health plan. So first place I would go is to your health plan site. That's one spot. Interestingly, a number of the pharmaceutical companies also engage us to provide onboarding and what we call persistency programs. Very, very effective. It really, if you think about those, the example we talked about at the very beginning, where I want to try a new device. The Abbott Libre is now a very popular device, and I don't know what it's like to work with that, or I don't even know how to get it started. We can help you do that. And so in those moments of care, to the transitions of care, in the moments of change, let's say change to a treatment plan, ask your physician, look us up, talk about Cecelia Health, and you'll find us through those engagements.
Nice. A lot of the folks who watch our content are themselves entrepreneurs, probably earlier in their process than you are. And so one question I like to ask sort of for them is, how do you stay sharp as a CEO? How do you keep your mindset calibrated, make sure that you're keeping the main thing?
Well, that's a good question, especially when, as you hear my dog barking in the background, you have a lot of distractions, right? So there's, I think there's easy answers, and it sounds sappy. I think to a certain degree, you got to take care of yourself. If that means exercising, figure out a way to move. And you know what? You have to, especially when you're working from home, you have to move. Find what it is that creates the slower thinking time for you. For me, it might be mowing the lawn. So my lawn gets mowed an awful lot as you're working out issues. You have to find those moments, because as an entrepreneur, you're just bombarded with task after task after task and issue after issue. And people want to talk to you, and you want to grow your business. And very rarely do you find those moments where you can sit back and really take it all in and start to see the broader picture. So find those moments.
Awesome. Any last items you want the world to know about Cecelia Health as you break into your role and look ahead at 2021?
Look, this whole virtual care realm, there are some exciting things going on in healthcare. We're seeing just a tremendous sea change in terms of how healthcare will be delivered. What it looks like 5 years from now will be completely transformed, and a lot of those hooks and the underpinnings, the foundational elements are being set right now. This, to me, is one of the most exciting times to be in healthcare. Frankly, it's always been very mission driven, of course, but right now is really transformative. And finally, technology is able to support clinicians in the appropriate way. And what I'm most excited about is how we can really bridge some of the navigational elements, so that you don't have to just be in the four walls. You can actually take your care with you, so to speak, and the clinician can be there with you, so to speak. And so a lot of reason to be excited. And for us, where we're primarily focused on chronic disease management, again, these are diseases that people live with for the rest of their lives. And so we're here to help.
You mentioned a minute ago how competitive the space is, but that's also indicative of the massive opportunity for impact. So excited to really get to meet you, Mark, and to hear about your vision for Cecelia Health. We love what you're doing, and really are going to be watching what comes next for you and the team.
Well, thank you. Again, appreciate the time, Logan.
All right. Take care. Be well.
All right. You as well.
Bye.
A quick word about this show, in case you're new around here. At Startup Health, we believe in broadcasting the stories of health moonshot progress, the stories of the most forward-thinking entrepreneurs in health. If you want more of this good news about healthcare's problem solvers, make sure that you subscribe to our channel, hit that notification button, and follow us on social media at Startup Health.